This story touches on a problem known as tunnel vision, which affects some children in a way we'll tell you about in a moment. But even more serious than the problem may be the kind of treatment one Sydney doctor is proposing for it. Dr. Frank Gorman is a duly qualified and registered medical practitioner who believes spinal manipulation could be the answer to a lot of ailments, from headaches to arthritis, not now being adequately treated by traditional medicine. Neck and spinal manipulation is an area usually identified with chiropractors, and a lot of doctors look upon many of their techniques as useless or even dangerous. Recently, there was a case of a doctor who was struck off the medical rolls after one of his patients died from neck manipulation. That's just how dangerous it is. But Dr. Gorman persists, not only persists, but was happy to demonstrate his treatment for our cameras. Be warned, it'll come as a jolt.
Just gently.
It looks like torture, but this 20th century version of the medieval rack is Dr. Frank Gorman's controversial treatment.
All right, now we do a wobble now. Rock his body on his head. Right, now we give him some more oxygen.
Dr. Gorman is a general practitioner and a self-styled chiropractor. This manipulation of the neck and spine is his treatment for tunnel vision, an eye problem that most other doctors say is psychological, not physical.
That's good. So it's quite severe, really.
If 11-year-old Chris could see what was happening, there's no way he'd be lying still for this. But he's unconscious. Dr. Gorman needs them soft as putty, or as he says, like butter in his hands.
The way to break a bit of butter is to freeze it. If it's soft, you can't break it, it just squashes. In the same way, I think it'd be quite difficult to break anything.
A man died in Sydney after a blood clot and a neck manipulation. Isn't that a risk in your technique?
Oh, of course. Of course. And I make it very clear to the patient that it's a hard option. To have your neck manipulated it's serious business.
Would I be right in saying you see a danger in a manipulation, but you think it's a risk worth taking?
Totally. Yes, I see a very big danger in it. It's, if you happen to be the person that gets damaged by it, you can be quite certain you'll be badly damaged. Can't you see them out there, Christopher?
No.
Surely.
No.
Before the manipulation, Dr. Gorman gives the kids a test for tunnel vision. He openly admits the dangers, but the way he convinces them to go through the treatment is quite bizarre. He gives them a book, Rejuvenation of the Mind by Franz von Kerbel. But what Dr. Gorman doesn't tell his patients is the Darwin Academy of Chiropractic Medicine is not a recognised medical organisation. It's a creation of Dr. Gorman's. And Franz von Kerbel, or rough translation, Frank the Crank, is a pseudonym for Dr. Gorman. Why did you feel it necessary to hide behind a pseudonym?
Yeah, I think I was badly advised, really.
What is your reaction to the charges that you are a quack, that you're an eccentric, that this may be as much charisma or fakery?
Well, again, it's the evidence, isn't it? It's you know, what can I say? I see that 25 patients who've been subjected to this have been well instructed in the dangers beforehand, and they've all got better. I'd have to be a fool not to think that there was something in it.
It was Chris's parents, Les and Pam, who discovered he had tunnel vision. Like most kids with this eye problem, Chris didn't even know he had it.
There was this dance, I was dancing with a couple of my friends, Vanessa and Amy, dancing around, and accidentally a couple of times I trod on the toes and then jumped. With tunnel vision, probably one of the reasons why I may have trodden the toes accidentally.
You're going to blame your lousy dancing on your tunnel vision, are you?
Yeah, I guess so.
Chris hopped on his bike to show us what it's like to have tunnel vision. Most kids would be able to see the car well before the danger point. But Chris can't spot the car until it's completely past him.
I had to turn my head to see where I was going to go. If I was going to turn around or something, I had to turn my head right around pretty well.
If your eyesight is normal, this is what you'd see riding the bike. But with tunnel vision, Chris's world closes in to something like this. According to Dr. Gorman, alias Franz von Kerbel, this tunnel vision is part of a wider illness, something he calls dullness of the brain. The symptoms, he says, are headaches, irritability, tiredness and poor concentration. The such everyday problems that most of Dr. Gorman's patients have been told by other doctors there's nothing seriously wrong with them.
It used to get me really frustrated not knowing what was wrong with me. I knew I had something wrong with myself physically.
Julie is a 17-year-old schoolgirl. Her parents have lost count of the number of doctors she went to complaining of headaches and backaches.
You go to the doctors and they say, no, you can't, there's nothing wrong with you, obviously, it's all in your mind type of thing. They wouldn't say it out straight, but in roundabout words, and it used to get me really frustrated knowing that.
They kept telling you you were really mad.
Yeah, in just about in roundabout way, yeah.
Her x-rays would show up fine, nothing the matter with it, so they're trying to tell her it was all in her mind. But they didn't see the pain that she was in, and no child can put on a pain like she's been in, because at times I used to cry myself seeing her in the pain because there was nothing I could do.
Keep going. Keep going. Come on. Go on, harder. Go on. Keep going.
When Julie took her problems to Dr. Gorman, it was very different. He convinced her, like he'd convinced his other young patient, Chris, that the problem was tunnel vision and that he held the cure in his hands.
Wobbly, nausea in the stomach.
Has that ever happened to you when you played sport or anything like that at all?
Yeah.
Tell us about it.
Dr. Gorman told Julie she was getting dizzy here because she had a blockage in her neck and not enough blood was getting to her brain. He said she had a physical illness, but other specialists did not agree.
All right, I'm going to use some testing lenses on you now, Julie.
Angela McCarthy is an optometrist at the University of New South Wales. 60 Minutes arranged for her to examine Julie and Chris before they had Dr. Gorman's spinal manipulation.
I'm going to be shining a little light in your eye. I don't want you to look at the light, just look at the red circle that's moving down at the end of the room, all right? See it yet? Not yet? Not yet? Not yet?
She confirmed they had tunnel vision, like Dr. Gorman said, but where she disagreed was on the treatment. From an optometrist's point of view, the kids don't need a drastic manipulation, they need counselling. Do you think they're foxy kids, that maybe they're just able to trick some of the doctors that look at them?
If they are, I don't think they're doing it intentionally, but there may be some deep-seated psychological problems that they have that they just can't face up to, and they're looking for a way out.
The way out for Julie and Chris was Dr. Gorman's spinal manipulation. He began by knocking them out with an anaesthetic.
We give them one drug to put them to sleep and then a second drug to paralyse the muscles.
There was a trained anaesthetist there and a nursing aide. Everyone, including Dr. Gorman, was psyched up, believing they were about to see a medical marvel.
Okay. Just inside there.
You could actually hear the cracking and crunching of Julie's bones.
Yeah, good. That's good. Now, the other side. Hang on,
They pulled at her head with the strength of two men. Dr. Gorman's assistant was a man who described himself as a horse chiropractor.
Keep going.
This violent twisting of Julie's spine, Dr. Gorman claimed, would increase the blood supply to her brain and cure the tunnel vision.
What we do, I believe, is we somehow make the blood vessels going to the brain, put them in a better position, and oxygenation of the brain improves, and then a lot of these things get better.
How risky is it?
Well, you can't think emotionally about it, Jeff. You've got to think statistically, and statistically it's hardly risky at all. You know, it's an insignificant number of people being killed compared with the number of people that have been treated.
Dr. Gorman has never been held back by the dangers of spinal manipulation, but listen to this. Medical authorities we've contacted say there is a terrible risk. A professor of surgery at a leading hospital says putting patients under an anaesthetic leaves them defenceless against the extreme force being applied to their bodies. This specialist and others has warned of the risk of a stroke, plus the considerable danger of severe back problems, even paralysis.
Rock his body on his head virtually, and then relax for just 2 turns, and you get a few creaks.
If there's anyone horrified by Dr. Gorman's spine twisting, it's chiropractors who specialise in manipulations.
Rock his body on his head virtually, and then relax.
How normal is that?
And you get a few creaks.
It's gross. That's very extreme.
Warwick Bateman is spokesman for the New South Wales Chiropractic Association. Although chiropractors have been fighting for medical acceptance of their techniques, Dr. Gorman's use of an extreme manipulation without formal training has the association worried.
Now, what about that? I mean, he's shaking that kid like a rag doll.
Goodness me.
It's that little twist at the
That
end.
little twist at the end is even more concerning, more worrying. It's almost going beyond the anatomical limits of the body, that twisting that lower spine there.
It's a bit terrifying to watch this, isn't it?
I can understand you being terrified looking at it as a layperson, but as a chiropractor, I'm even more so. I'm horrified. I wouldn't let any of my kids undertake it, or my child. I'd be grossly alarmed. What he's actually doing is pulling the whole thing apart, and the ligaments are there to hold it. And under the anaesthetic, you don't have that feel to show you how much the muscles will let it go.
It could be dangerous.
Well, it could, at the very least, it could injure the muscles there and give them quite sore necks.
And at the very worst?
At the very worst, well, I would hate to think of that.
Have you had a death on your hands?
Nearly. I've written up one case in the Medical Journal of Australia where the man, I thought, died for about 90 seconds following a manipulation without anaesthetic.
Without anaesthetic? What do you think went wrong that day that you had a problem?
No, I don't know. I wouldn't have any idea. And that's the usual thing. When they have a tragedy from spinal manipulation, it's totally unexpected.
So you've had one patient with a stroke and another patient whose heart stopped for 90 seconds. So there is a risk.
The dangers of not being manipulated are infinitely worse than the dangers of being manipulated.
Though some optometrists will say tunnel vision is a problem that will just go away in time.
That's certainly said, and I honestly don't know the answer to that.
Let's try another one.
So the procedure is dangerous. But does it work?
Which one now?
The one over there.
When Chris regained consciousness, something had certainly changed in him.
I think you're going to be a whole new boy on a bike.
It's just terrific. Just terrific.
Julie also got over her tunnel vision. A medical marvel? Maybe. But to look at her, you have to ask, is it worth putting a kid through this for an eye problem that usually goes away on its own? And even Dr. Gorman can't dispute that the cure could be all in the mind. Most optometrists appear to say that it's a hysterical condition, that it's all in the mind of the patient.
Yeah, well, I'd certainly agree with that. I mean, I don't have any doubt about that. What I'm questioning is the nature of hysteria in a lot of cases.
All right, let's be really adventurous and go down to number 10 and see.
A week after the spinal manipulations, our university optometrist retested the kids. Not only was Julie's tunnel vision gone, but her overall eyesight showed a dramatic improvement.
That's 5 lines better than last time. Just going to turn it around. Keep watching. Just tell me as soon as it disappears.
It's gone now.
Gone now. Very good.
Chris also lost his tunnel vision. But Angela McCarthy still believes that their problems and the cure were all in their minds. It's what she calls the placebo effect. They think they are better, so they get better.
This is a well-known entity in all the areas of medicine, that if you do something different for somebody, or perhaps even just give them a sugar pill, or do something that and convince them that they're going to get better, they will.
When we told you about these manipulations, did it sound like quackery?
Yes, it did sound a little bit like quackery to me.
It's the mandate of doctors to cure things. How they do it is should be totally open to them to use whatever methods they can.
Well, I think if there's a placebo effect, you should just show the future patient this film and say, if you don't get better, that's what we're going to do. If you've been doing that for a long time without any problems, I think you should buy a few lottery tickets. Is that lucky? That's incredible.
Fred is here with us today, and he's been sick for 7 years, and 3 years ago he was investigated for blackouts, and he has had over this time a sore back. Now, we manipulated his spine a month ago and made his back better, but just recently he's become distressed in the same way that he was distressed before, in that if he lies down he gets a feeling of agitation and has to get up and drink large quantities of water. And you couldn't lie on your back, could you, Fred?
No.
Can you tell us just quickly about your illness over these 7 years?
Starting where?
Anywhere.
Just blackouts. Used to get cranky at people because you wanted to rest. Couldn't sleep. Shift work, couldn't sleep. And couldn't rest during the day to do shift work. And used to just black out.
Yeah. Do you think have you ever hurt yourself in a blackout?
No, because I can get up.
You can get up straight away. Very good. And you've been a bit sick for the last couple of days?
Yeah.
That's right. Okay, Fred's obviously distressed with his problem at the moment, and the significant thing is that he has quite a very dramatic disturbance of his gaze. So now we'll look at his eyes.
Don't look at me.
No, we're going to come close. Right. The finding of Fred's most interesting eye problem, which is only new and wasn't present when examined a month ago, he now, if he looks to the wall, Fred, following my finger to the wall, you see he has no capability of looking to the lateral side. And look at me, Fred, please. Turn on this side, look over here. Just, well, make your eyes straight. Look at the camera again. You see that when he tries to look voluntarily, he is unable to do so. He can do slightly better to pursuit movements. The whole business of using his eyes, it's very distressing to him in his present state. Has great trouble getting his eyes back into central focus again. And now this time, Fred, we'll get you to follow my finger. No, just gently now, don't worry. And he's able to do it. And this side here, follow it. This time, in trying to follow it, he has a failure of the abduction of the eye on the same side, ipsilateral eye. It's can't get it out. Right, it's very variable. Sometimes he changes. Now, what is interesting is that he has no trouble if he's uniocular. Just looking across here, of course, Fred. When he goes across there, looks there quite reasonably, and both eyes are abducting. And coming back, he has trouble getting back to the normal situation. If we do it on the other side, Fred now coming out here for us. And he can abduct, as long as he's only got one eye to use to locate with, following this out, please, Fred. He can do it as long as he's uniocular.
Start to shake me.
You're all right, well, Fred is very interesting in that if he looks without looking up there, he can do it that time. On this side, right. Now looking again over there for me, that's good. Just getting relaxed. Now looking to this side, please, Fred, follow the finger out. You can do pursuit movements with this difficulty on both sides. But if he's got the one eye closed, following this out, please, Fred, you can get it out quite easily, and both eyes are in the direction of gaze. See this side, follow it right out. As long as he's uniocular, he's all right. He's got a bit of mistakeness there. And he comes back quite well. And again, binocularly, has difficulty. Binocularly, again, has difficulty. Convergence is, watch him coming in, please. Convert, right in. This convergence is quite good. because Fred has had his illness for 7 years and generally is not very ill, and this new condition coming on quite acutely, we can be fairly certain that he's suffering from a cervical syndrome or oculovertebrovascular insufficiency. And we can demonstrate this by arm exercise. Now, Fred, I want you to exercise your left arm fairly enthusiastically, windmill it the way, you know, right over. And as soon as you start getting very sick, tell us, don't get yourself get too sick. Is anything happening? Keep going a bit harder. Starting to stare a bit. Keep going. Tell us as you go. Quick. Off you go. What's happening?
Okay.
Right, stop now. Look, stop. No, we'll just lie down on the ground because you could take it. When you do an arm exercise test, you realise that you're testing the patient's vasculature to their brain, and you've got to accept full responsibility that you are in fact embarrassing their circulation for a time. So that you must lie them down if they're stressed. Do it.
Those feet up.
Bring a chair back, thanks. So that's the positive arm exercise test. And so it's a form of subclavian steel. Now, Fred's had his manipulation this morning, and his symptoms have, or his signs have disappeared, and we now wish to demonstrate that to you. Did the manipulation hurt much, Fred? No. Didn't worry you. Did you? What happened when, as soon as you woke up? What did you feel any different or anything? Just the same. Very good.
Oh, felt like normal, I suppose, after the ice.
Great. Terrific. That was immediately on waking, while you're still lying down.
When I come propped, yeah.
Properly. Very good. So he has in fact got completely better from his symptoms that he had this morning. Now, we'll remember the signs before the manipulation. So as Fred tried to look laterally, looking out there, Fred, he couldn't do it, and he had difficulty abducting the ipsilateral eye. To this side, Fred, please. And now that he's able to do that quite comfortably, quite easily, without any hassle. Up and down. He's now regained full control of his eyes. And looking to the wall and back, just shake them aside, the other side. But there's no problem. He had both voluntary and pursuit distress prior to manipulation. Now he's all right. That's immediately after the manipulation. We'll now get Fred to converge on the and he converges quite confidently. No problems. And now we'll demonstrate that the reason Fred's better is because his vasculature of the brain stem is better. And this will be manifested by the fact that he doesn't now get distressed as he exercises his arm. So Fred, we'll get you to do the same test as we did before the manipulation, and you'll see how you go. Away you go. Fairly hard this time because we'll speed everything up. Much harder than that.
I'm not good, probably.
No, you won't be wrong. Keep going. Much harder than that. Harder, harder, harder. Fred's really exercising quite hard. Now, I didn't let him do that before because I didn't want him to faint totally on me, as I knew he would if I made him. Are you getting distressed at all, Fred?
No.
Keep going a bit longer.
Getting puffed, but
Getting puffed and not distressed. He couldn't have done this before, and if we'd made him exert himself at this rate, he would have gone probably completely unconscious. Right. Are you distressed or what? No, you're still all right. Certainly much, much better than you were before. Well, Fred, thanks very much.
yeah. Well, can I work or what?
Oh, yes, yeah. Do whatever you want.
Till next time.
Till next time.
Hazardous waste thing out the corner.
definition is quite right. Dial on that.
What's that?
It's the bell's gone.
Yeah, go for it. Whatever you got. So that it actually films that image for 7 seconds.
And the cue is the red.
That's saying that it's actually recording. Once you know that you.
So you'd had a lot of trouble walking that big thing around, didn't you?
Yeah.
So now we're taping, it's saying recording. Now it's taping. To stop. And then that's recording. You can actually, and that tells you how much life you've got in your battery.
30 minutes.
Yeah.
And it hasn't been touched for how long?
Well, this one's probably fully.
Yeah, I think so.